Welcome back to the program. So we're going to do 3 topics tonight. Segment 1 that you're going to see is absolutely terrifying, and you have to see it to believe it. It's all about AI, and you'll see what I'm talking about. The other 2 are going to be a little bit different, but this one in particular I want to talk to you about is the fact that all through COVID, coronavirus, all those videos that we did, we proved it was a pandemic. We proved that this was a, lab created virus and all that. But more importantly, I said, and I still say to this day, and I will continue to say until I'm proven wrong, that there's literally only money in treatments. There is no money in cures. If these pharmaceutical companies go out and cure all what ails us, they're all going to go broke. And so the sad reality is that they put profits in front of people. And as I said, there is no money in cures and only money in treatments. And not just money, but billions, if not trillions of dollars. Well, we have seen horrible diseases like cancer and other diseases out there. And we've got to wonder, is there a cure? Do they really have a cure? We've heard of different things. We've seen different studies, but nothing has been concrete, right? Well, now we know for a fact through independent studies that ivermectin and other drugs absolutely cure cancer. That's right. They don't want you to know that. And that's why during COVID, when people got COVID, it was an antifungal, it was an anti-parasitic, it was a Nobel Prize winning drug. And when you got COVID, what happened? You got ivermectin and you got rid of the virus. You didn't need the jabs. You didn't need to get myocarditis and pericarditis and strokes and advanced cancers and all that stuff. They wanted you to get all that. They wanted you to be on that ventilator, right? $13,000 they would get for when they would admit you with COVID. $39,000 if you were put on a ventilator. And if you ended up passing away, and of course they put COVID on everything, right? They got another $13,000. So they incentivized your death, which is absolutely sickening. Well, now we know that at least since the 1950s, there has been a cure for cancer. Listen to this. 50 years, the CIA and the medical establishment hid research regarding drugs like ivermectin and for cancer. Okay? According to the Daily Mail, a declassified CIA document is raising concerns that the agency purposefully suppressed information that could have been a valuable tool to treating cancer. A newly surfaced document suggests that U.S. intelligence once reviewed research that hinted at a possible cancer cure and treatment more than 60 years ago. That document was produced in February of 1951 and declassified in 2014, and it summarizes a scientific paper that examines striking similarities between parasitic worms and cancerous tumors. The report describes how researchers believe both organisms thrived under nearly identical metabolic conditions and accumulated large reserves of glycogen, a form of stored energy. Indeed, the research regarding antiparasitics and cancer at the time was showing promising results. But of course, we don't want that to get out because we've got to make money on all you people. We need you sick. The sicker you are without dying, the more money we make, right? The research also highlighted experiments showing that certain chemical compounds were capable of targeting both parasitic infections and malignant tumors. That's right. One drug, Mirasol D, was reportedly effective against Bilharzia parasites as well as cancerous tumors and growths, hinting that treatments developed for parasites can also attack tumors. According to Nicholas Holscher with the McCullough Foundation, instead of being used to advance critical cancer research, the document was buried for over half a century. Even recent data was also ignored. It's not just the results of these studies that were buried for decades by the CIA and others. The off-label use of anti-parasitic drugs like ivermectin and mebendazole have demonstrated highly promising anti-cancer activity in preclinical trials. But despite compelling preclinical data and documented safe use in cancer patients, robust clinical evidence evaluating the ivermectin and the mebendazole combination in oncology remains limited. Treating cancer is big business, and one that makes the big pharmaceutical companies massive amounts of cash. Remember, in the height of COVID, they were making over $1 billion a minute, folks. $1 billion a minute. I covered that years ago. Okay? It's sick. In 2024 alone, cancer treatments generated at least $200 billion in worldwide sales for the pharmaceutical industry just in 2024. Now remember, during 2020 and 2021 and 2022, where they rolled out all these shots and everything else, it was the most amount of money ever made in Big Pharma's history in that 2.5 to 3 year period. We are talking trillions upon trillions upon trillions of dollars made by Big Pharma companies at our expense. Not my expense, because I'm not vaccinated, and I know most of you are unvaccinated as well, but at the expense of over 1 million Americans' lives. Given the massive profit motive, it shouldn't be surprising that Big Pharma has shown literally zero interest in lowering cancer costs and treatments. This is why we hear about those doctors, holistic doctors from many years ago that ended up being killed or found mysteriously missing or found, with gunshots in the back of their head, and they said that they were suicided, or a body swimming down, the Ohio River and all this other crazy stuff. Because I've said this before, and I believe this to my core, that the big pharma companies have so much money to lose if a treatment was to be successful and eliminate cancer, that they hire assassins. That's right, you heard that correctly. They literally hire assassins, and they go after the people that are trying to come up with natural cures. Okay? Now, listen to this. In this study, in one of the maiden studies here by the Wellness Company, a number of the colleagues recently authored a first-of-its-kind study of the application of those two drugs, ivermectin and mebendazole, in the treatment of cancer. And it's groundbreaking information. 84.4% reported clinical benefit, no evidence of disease, tumor shrinkage, and a stabilization. Imagine that, 84.4%. 48.4% reported the strongest possible outcomes. Tumor shrinked to practically non-existent and no current evidence of any diseases after using ivermectin and mebendazole. 86.9% completed their initial prescription, with most side effects reported as non-existent or very mild. Now remember, these are two Nobel Peace Prize winning FDA-approved compounds, and they have worked for over 50 years. They were treating malaria, parasites, malaria in Africa for many, many years. So when COVID came out, naturally, many of these doctors said, well, wait a minute, it's a virus, so it's a parasite, so let's treat it with ivermectin and hydroxychloroquine and see what happens. Oh, gee, look, our patients are getting better. Oh, no. We can't have that. We can't let that information get out because we need money, right? We need run death is near. Right, Fauci, you scumbag? So then it says that these mechanisms, ivermectin in particular, disrupts tumor growth and pathways, triggers cancer cell deaths, which is called apoptosis, while mebendazole starves abnormal cells by blocking their ability to absorb glucose. Together in one compounded capsule, they deliver a protocol that patients could actually follow, and they did. Now, cancer in and of itself is something that continues to grow and get worse with the shots, with the fact that the vaccines have brought on these advanced cancers, brain cancers in particular, but also cancers of the limbs and things like that that normally are very rare are now showing up even higher. Of course, all the, myocarditis, long COVID, pericarditis, anemic strokes, heart disease, heart failure, instant spontaneous death. I mean, how many athletes just dropped dead in 2021, 2022? Remember? We had a whole long list of like hundreds and close to a couple of thousand of these in their prime athletes, in their 20s and 30s and teens even, boom, dropping dead because of what this was. It was a bioterrorism weapon made from the horseshoe bat by Dr. Zhizheng Li, the bat scientist. I talk about it in Preserving Liberty. And she just kept splicing and splicing and splicing and splicing and splicing until this thing was potent enough to kill humans. And then it was released. So again, that's why China is so dangerous. So here's what makes it even worse. Cancer doesn't care about how healthy you are. It doesn't announce itself to you. And by the time most people find out about it, they're handed a treatment plan that's brutal on the body. Sometimes, they say that sometimes the cure is worse than the disease. Well, hey, a lot of that radiation, a lot of that chemotherapy, it may kill a tumor or a cancer cell, but what does it do to the body? My goodness. It absolutely destroys the body unless it's done precision strike, in one little area, but still, it's still going into your body. So how good could that be in the long run? Not very good at all. That's why they don't want you to use ivermectin. They don't want you to use mebendazole or whatever that stuff is called. They don't want you to use hydroxychloroquine, because if you do and you understand what's happening, or God forbid, get cancer and you start treating it with this stuff and you cure yourself, well, guess what? They didn't make any money on you. They didn't cut you up. They didn't carve you up. They didn't zap radiation into your body. They didn't pump chemicals into your bloodstream. This was and still is the biggest crime against humanity. And all of the COVID people, especially now, we have the proof. We know that there is cures for cancer a long time ago. We know what agents it is. We know what we can use to do it, because the results are showing in humans and in animals, in the testing and the trials. So someone's got to pay for this. Somebody needs to pay for this. And it needs to be the heads of these big pharma companies. It needs to be the researchers that blocked it, the medical establishment. All of these people, they all need to go down. We know Dr. Morens, it was in Preserving Liberty too, but recently being indicted, he knew what was going on. He knew that ivermectin and some of these other drugs were able to save people's lives, but he didn't want that coming out. Of course not, because it was all about this. These people are dirtbags. They are evil, satanic, bloodthirsty, evil bastards, and they don't care about anything other than their own paychecks. Those are my thoughts. What are yours? Put them down in the comments below. We'll see you in the next one.